Good afternoon. It is Saturday, January 21st, 2023. I'm Delaware State Representative Paul Baumbach, and I wanted to present this Facebook Live really for me to introduce, for the first time for me through Facebook Live, an issue that has sparked an awful lot of interest and controversy over the past 6 to 12 months regarding Delaware State employee retiree healthcare benefits. Got all that? And we'll be doing a whole bunch of looking into acronyms and initials. So I wanted to warn you ahead of time about that. One of the reasons that I am doing this, two reasons really. One is that I've recently been appointed to serve on the Retirement Benefit Study Committee. So I'll be involved with reviewing a lot of information, listening to a lot of input, and the committee will be charged with making recommendations. But I also want to discuss Senate Bill 29, which passed the Senate last week and is expected to be considered by the House this week. And among other things, it would reinvent that committee, give it a new name. I'm expecting to be appointed to that committee if the bill passes, but I don't know. But I likely will. It won't surprise me if I offer some of this Facebook Live format, probably often on weekends, to give a little update and also to give an opportunity for people to raise questions, and I will field questions as best I can. And one of the nice things about Facebook Live is not only can you ask questions and I can try to field them, but also it can be stored and you can catch it later if you don't catch it live. About a week and we have 9 days ago, members of Governor Carney's administration shared a presentation with the legislature. So I wanted to share that information because I think it's pretty important. It a little bit sets the framework for what we're talking about. But first, let me give a brief background. Let me start by saying I'm not an expert on this subject. I've been did some serious diving into the issue to try to catch up and understand it as best I could. This summer, everything sort of hit the fan in early August. There were public meetings in September and October. We had briefings from the administration. We heard from a lot of constituents, including an organization called Rise Delaware, which consisted of a lot of retired state employees who were very opposed to a proposed change. I need to back up some more. Early last year, the state administration chose to change the plan, the retiree healthcare plan, as of January 1st of this year. So they did this. They made a decision early last year. Then they went through the big negotiation process with the winning bidder. And then a lawsuit was filed, largely from the organization Rise Delaware. In October, a judge ordered that the proposed change not be done, and that the then current system known as MedicFill, which is a Medicare supplement program, be continued at least through calendar 2023. That's where we stand right now. And so we've got that. I see we've got some questions already. Sherry, why did the pensioners have to take a less than adequate care as a result of the state going into financial despair in the policy coverage? It's an incredibly good question. I will get to that. And again, Sherry, that's a very good question. It reminds me that I should take some more steps backward. And the presentation that I'll be sharing with you shortly gives some of it, but I think the most important thing is that the state is a big employer, and employers make commitments to employees, including what they'll do for a current employee for healthcare benefits, for instance, maybe life insurance benefits, and also for retirees. Many employers offer a pension. The state of Delaware does that. Some employers offer healthcare during retirement, usually, historically, usually as a supplement to Medicare. And that's how the state has done it in the past. Um, those commitments are obligations to some extent or another. By that, I mean, it can be rock solid, a unchangeable obligation, or it can be a changeable one. We in Delaware can look to the example of the DuPont Corporation, which had provided, had provided a pension, did a shift towards their SIP plan or a 401k plan, so that new employees were just getting the 401k rather than the defined benefit pension. In addition, DuPont used to offer, I believe, a Medicare supplement, and then they shifted to you have some dollars that you can pay towards whichever Medicare supplementary program you would like. So those were changeable obligations. With the state, one of the issues is you can quantify. We've got this whole profession called actuaries who study the numbers and say, this commitment costs these dollars. You've set aside these dollars. They're less. Can you get it on the camera? They're less than our obligation, and therefore you have a shortfall. Those are two classes: the pension obligations and other retiree employment obligations. OPEB is what it stands. It's the initials for it. And years ago, we found that the pension promises were much higher than what we had set aside, and the state undertook a multi-year, like a lot of year program of building up the reserves to catch up to the promises within the pension. And we're now about 85% covered, which is essentially a gold standard. That's where you want a state to be, somewhere north of 80%, and we're there. We did not take that same path thus far for our other retiree benefits, specifically the retiree health care. And it is one which elected officials, since we don't like them, we're going to call them politicians, kick the can down the road year after year after year after year, decade after decade. The federal rules, the requirements of tracking this, reporting it, have gotten more strong. And I'll say it causes states to be more embarrassed by that discrepancy between the promises and how much you've set aside towards those promises. So it's important. So the state has more and more incentive to address the issue. One additional factor is when that difference is very large, whether it be pensions or the retiree health, then rating agencies, bond rating agencies can say, you know what, state blank, you got a big problem. And we're not as confident that when you went to borrow money to pay for a highway in your state, that you're gonna be able to pay back that 25th and 26th and 27th year payments. Our confidence is lower, and we're going to change you from an A plus to an A minus or a B. And when those ratings change, that changes how much a state has to pay when borrowing. So borrowing costs go up. We're seeing that at the federal level with a whole discussion about the debt limit, what would happen if we exceed that. But the state of Delaware is like all states, worrying about its credit rating and retiree health care, that imbalance between the promises and the reserves. When it gets too great, then it threatens those ratings, and that threatens the cost of government going forward. That gives more incentive for the state to say it's time to stop kicking the can down the road. And that occurred really the past 3 years, I guess, is when the administration, which has some committees to do this, started looking at it and saying, we really need to start addressing it now. And we'll talk about how we're doing that. Let me look at questions, and I want to go to the presentation. John, thank you. Sherry, I think it's very important when the state also wants to now run an investment plan for employees through the state. If we can't even run a plan for insurance, how can it be long-term investments? And Sherry, thank you, Sherry, thank you for your thank you. In the second one, really, we're talking about very, as far as the state retirement plan, the state pension has been, I think, Mifflin would say, pretty well run for a long time. The 529 is another one the state oversees. So I imagine you're talking about the EARNS Act, the EARNS law, in which small employers which don't offer retirement plans for their employees have access through the state of Delaware for a retiree plan. I think the state actually has run its retirement plans pretty darn well. So I wouldn't agree with your assessment, Sherry. I understand that. That is how you view that. that carryover. With my financial background, I really do look at these as they have a lot of similarities, but they also have a lot of differences. The strongest similarity is we have promises. You can put a dollar sign on that. You have reserves. You have a dollar sign on that. And when they're way out of whack, that's a big problem. But as far as how we run each of them, I think it's really it's really not managing the plan. It's the government paying for it. Again, there's parallels to the federal government. Are we paying it as we go? Are we waiting until a big bill comes? Are we, making our obligations? Are we preparing for a known increase in the future? That's what we're facing. So with that, let me start on presentation. So we got my little picture here on the side, but let's go through this here. So this is a presentation that the current administration's representatives shared with the House Democrats on January 12th. I believe they spoke with all four caucuses, so both chambers, both parties. And I also verified that this is public information. I can share it. So what they talk about, so MedicFill, that's the term for the current Medicare supplement. It is a commercial plan in that the state put out a request for proposal, asked different companies to bid what they can offer for what the state was looking for, which was and this was put out to bid maybe 4 years ago. It's now in its fourth year. It was originally a 3-year, or maybe it was a fifth, maybe it's in the 6th year now. I think it was a 3-year contract, could be extended for 2 1-year periods. We extended it 1 additional year because of the court's requirement. But it's a supplement. So your bills go first to Medicare, and whatever Medicare doesn't cover then goes to the MedicFill program. So that's that supplement, that second level coverage. It's administered through Highmark, which is they call them nonprofit, but they're a really big company. And Highmark, Blue Cross Blue Shield, fairly certain they're a nonprofit there. So you can see that there's around 30,000 people covered, mainly retirees, but also spouses. And that contract did expire this past December 31st, but it was with Superior Court ruling, it was extended for 1 more year. It was the way it was bid, it was not available to be extended another year. But the court case required that, and therefore there was language. There's language either in the contract or in state law that says when you're compelled by a court to do something, you have to do it. So the state really, in a sense, renegotiated with Highmark Blue Cross what the premiums would be, what the cost to the state would be for this current year. And it's more than what we had planned, and it is more than what was in the budget, because the budget was based on this move to Medicare Advantage, which is, I understand, has a lot of people who are very opposed to it. But regardless, it was voted by the legislature, signed by the governor, to be changed as of January 1st, and it would have had a lower cost. So with this move back to MedicFill for this calendar year, that's a greater cost than the budget had. So it is what it is. The cost to extend it is $70 to $80 million for the year, and that's the difference in paying the premiums and the claims. One of the things about MedicFill is it's a self-funded program, which means the state pays. So Highmark administers it, but then the ultimate bills above what Medicare pays is paid by the state. So it's a self-funded one, as opposed to one where we pay the premiums and then the insurance company pays all the difference. And that's been a problem because that difference has been growing, and that's a big challenge for the state. This table called 3 columns and 4 rows. If you go to the far right, what you can see is that state employees who are the far right on the bottom, current employees pay about 21% of the premium for their health benefits. So if the overall premium is $1,000 a month, the state employee pays $200 or $217 a month, and the state pays the difference. So let me go to the ones I know. If you go up to So that's a retiree who's not yet 65, not covered by Medicare. Again, they pay in the order of 20% of the premium. The state pays the rest. But if you come down to that third row down, this is someone of Medicare age receiving Medicare. You're a retiree or the beneficiary spouse, say, of a retiree. There you pay 0.4%. And we're not saying that's right or that's wrong. That's how it is today. That is how the agreements have been made, and that's how it's structured. So really, there's minimal, if any, and that's just pretty much those who maybe retire before having a lot of years and have to pay 25, 50, or 75% of the premium. But most of the employees have had the 30 years and don't pay any of the premiums, or retired early enough that there was no requirement to pay the premiums, which is why that percentage is so low. Again, this is neither right nor wrong. This just is. Okay. So this is one where as premiums rise, this is not something that the state can share that in the current structure with retirees the way that they do share it with current employees. This is how it is. And I'm going to get to the questions when I finish the slides. There's not many slides. We're about 40% through right now. What this shows is that the healthcare costs have increased sharply in the past 15 years, 50% in the past 10 years, and 93%, or almost 100, almost doubled in the past 15 years. The state has not done nothing. They've worked on current changes to healthcare benefits to current employees. They have a new pharmacy benefit manager, or PBM, and that's designed to reduce the increases in prescription drug costs to the plan. So it's been making changes, and you can see at the far right of that graph that the increases have slowed in the most recent 3 or 4 years. And really, that's because of these efforts. In that case, perhaps largely PBM changes. So I'll say the state hasn't done nothing, but despite what the state has been doing, it's not anywhere near enough for the cost increases. Let me get over my mouse. There we go. Okay. So OPEB, this is the other pension employee benefits. So not it can't be pension, other than pension costs. Right now, what we owe based on our promises is almost $9 billion. We have about $500 million set aside. So 8.4 is uncovered. So it's an unfunded liability, and that's projected to more than double as far as the unfunded part of it, 146%. Well, you can see the increase there over the next 20 years. So obviously not sustainable. Now, this was unsustainable if you look 2 years ago at the progression. We have not, it's been in this same bad getting worse spiral for many years. Very seriously, this has been looked at the past 4 years or so, and this is where it is. So the annual deficits, it's one where we put money in based on what we think it needs. Sometimes the costs are higher. We have had we've had a fund for shortfalls. That fund has been used up by the costs that have been higher than the premiums coming in, both by the state and active employees. And so we're at the point now where we're paying every dollar that goes out, we're paying that from the budget. And that increase is just extremely sharp. So some of the things that can be done is the SEBC, that's the State Employee Benefit Committee. So that's in charge of employee benefits for both current employees and retired employees. And they're looking to raise monthly premiums for active employees and retirees who are under 65 years of age, about 10% annually for the next 3 years. They just in the current year increased the premium a little bit under 9% first time in 5 years. So there are steps that it's taking where it can for non-Medicare age retirees. But if it's bad. But there's only a certain number of levers that we can adjust or that we have adjusted so far. So what the administration presented to the caucus is that there are really 3 different ways to address the shortfall and get us to the point where the difference between what we owe and what we have saved is catching up. We're getting much closer. It's not something we fix in 2 years. It may not even be something we fix in 20 years, but we need to get on a glide path so that in 5 years, better than it is today. 10 years, much better. 15 years, much better. 20 years, much better. 25, 30 years, you may be at that 80, 85% level that we're really happy with. We can't do this in 1 or 2 years because that means we just like shut down the state so that we only put money into this. That's just not practical. You have to do the same thing we did for the pension many years ago, start chipping away at it. And what this administration is pointing out is a multi-path approach. So this is, I'm going to say, the most important slide. And I like it because you'll notice it doesn't say Medicare Advantage. That's what we need to do. Okay. Is that one element that can be considered? Yes, that's in the middle column, and that's the top one. Okay. And it's also mentioned a little bit in the bottom there, but it's in that middle column about current and future retirees. But that's not the only thing that we have available to us. We can put this all on the shoulders of the taxpayer. We're already, for the current year, putting 1% of the budget aside, which is somewhere around $50 million, towards that trust fund. And I expect, and I think most people expect, that we will continue that year after year after year until we get this solved, which again could be 20, 30 years. 1% of the budget every year. It doesn't have to be 1%, it could be more. We could, again, if we could put this all on that first left column on taxpayers, we can put this all on current and future retirees, the middle column. We can put this all on the right column of active employees. Really, probably the best approach is doing some kind of balance there. Ultimately, that decision is going to be the decision of the State Employee Benefit Committee, the SEBC. The committee on which I now serve is charged with reviewing this and making recommendations. The SEBC ultimately will make that. People will say, well, can't the legislature do something about it? Yes, we can. We can pass laws that say you can only consider the left column. You can only consider the right column. You can only consider the center column. You can take this choice out. You can add this choice to it. Those things are all possible. But right now, here are the three categories of approaches to start chipping away at this and reducing that shortfall over many years. So one is have the taxpayers do it. And that, I think there's a good argument because state employees work for the residents. And the shortfall is based on the work of state employees for the past 50 years. And so, you know, a lot of our taxpayers, like myself, have been state residents forever, for decades and decades. So that shortfall was done while I was a resident. It's sort of my obligation for both current state employees and past state employees who have helped me and my neighbors for so long. So you can say it should all be on the taxpayers. You can say this is a retiree benefit, it should all be on the retirees. Well, the middle column gives you some things you can look at there. And then the right one is just put on the current employees. I think really no single column solution is the best approach, but we're going to talk about that. That's what the RBFC is charged with looking at. So we'll see. But I want to point out very much that the administration is not saying Medicare Advantage, that solves everything. It does not solve everything. Actually, this first step from Governor Carney and the legislature, that 1% of the current year, and then a commitment doing that going forward, that does about 40%, 35, 40% of the shortfall over the next several decades. That in and of itself, that one step will get us not halfway, but more than a third of the way there. So we're well on our way. Medicare Advantage, if we did that, would be a piece. Actually, it would be have smaller impact alone than just the 1% solution alone. But that's what we'll be looking at. So I wanted to share that input from the committee, from the administration. And then the other thing I want to mention quickly, and then I'll go right to questions, I swear, is I want to talk about Senate Bill 29. So that, again, came before it. Let me go up top. What you'll see is it has 10 people's names on there. Those are the 10 selected leaders of both chambers, both parties. All 10 of them are there. And they worked on this bill and then presented it last week. And I'm going to jump down to the bottom where the synopsis is. And it's 4 paragraphs. So it expands the membership of the SEBC. It adds a state retiree to the committee and adding an additional representative from a public sector union, so current employees. It requires biannual reports from the Controller General. Controller General is our bipartisan financial oversight, not oversight, financial assessment department. So they really assist in the budget development, but they really don't answer to the administration. They're pretty independent, which is nice that way, doing a good job. And then the last is, and this I said, they're reinventing the Retiree Benefit Study Committee to be the Retiree Healthcare Benefits Advisory Subcommittee. Yeah, it's about the same thing. It's a subcommittee of the SEBC. It will have 4 legislators on it along with others. It will be chaired by the Lieutenant Governor, Bethany Hall Long. She has background in healthcare. She teaches nursing at the University of Delaware in addition to her Lieutenant Governor obligations. And what that new subcommittee will be doing is, you see, that public hearings and reviewing the choices, really looking at those 3 columns and saying, what do we want to pick from column A? What do we want to pick from column B? What do we want to pick from column C? How much, what levers, what dials, settings do we think is best? And then share recommendations. With our main thing is we report to the SEBC, but it also asks for a status report as of May 1st of this year to the governor, to the General Assembly. There is a lot, I'm sorry, before I finish, I want to say there is a amendment that was added to the bill by Senator Townsend. And what it does is it makes sure that for the SEBC, for a committee like the SEBC, normally it says that let's say the Controller General or let's say the Lieutenant Governor is appointed to it. And attendance, it can be them or their designee. So they can have their chief of staff attend in their place, or division director or something like that. This says, nope, this is too important. For the SEBC, it has to be the person. We want that accountability of that, usually a department secretary or whomever it is. That person has to be there, not somebody who stands in for them. And that I think is pretty important. And then, I'm sorry, and also that the same thing with that subcommittee, that we're the new RBSC, which is the RHBAS, also those designees. And then the last piece is that it points out, and the way that SB 29 is written, it's not the way I would have written it. It wasn't my bill, but that's fine. It does the right thing in my view, but it makes it really clear that one of the things we're going to look at is what options can we offer? Because one of the very loud concerns raised last year is there's no choice. A retiree, if they didn't want to go completely out of pocket for a Medicare supplement, they had to just take the one choice offered. Now, current employees like myself can choose one of like 6 different healthcare plans. What was being proposed to all state employees of Medicare age was Medicare Advantage, one plan, one choice, no choice. Get it, take it or not. So one of the things that explicitly is added here at the end of this amendment is make sure you also look at the option of having choices. So offer a choice in there, include options. I like options, I like choices. So that's what that did. I'm now going to come back and I'm going to read some questions, see what I missed here. Okay, let's see. That's what happens when we kick can too many times. Yep, pay up front or at the end with compound interest. Sherry, very, very accurate. Question about the excess funds over and above the budget. Can there be a one-time transfer to assist in this? It's been done in assistance. So Sherry asks, okay, so we've got this big shortfall in this trust fund. We'll call it a trust fund. That's not really the term, but we'll call it a trust fund. Sherry says, can you make a one-time shove money at it? Absolutely, yes. And frankly, that's one thing I've got, you guys know, I'm a numbers guy. And it also means I've got opinions about financial things. And I often hear people say, oh, we have a surplus. Well, okay, you gotta, definitions really matter. In our state for the past few years, our projected income has been higher than we had been spending. So that was good, and that's called a surplus. But I think it's really important to know, is that surplus expected to be ongoing, or is it one time? And if you've got a one-time surplus, then you should not use it to start new ongoing spending. You should use it for one-time spending. And here, Sherry, your point's perfect. Over the next 20, 30 years, every time we have really good one-time surpluses, let's take a third of that and put it towards this hole and get to that 80, 85% level faster and faster. So in good years, let's set more aside. Really good when we have one-time surpluses, let's use some of that specifically for this shortfall, which we've been ignoring for too many decades. So great point. Could you please post a public hearing link? So great question. And what I want to do is come over here. All right. And let's go to. All right. So you're asking, how can you look up where public meetings are, right? So here's a good place to start. Google. And I'm going to say Delaware Public Meeting Calendar. And you can just say Delaware Public Meeting. And you will get the following. Public Meeting Calendar, State of Delaware. And you can say in here, let's just try SEBC, which is the State Employee Benefit Committee. What the heck, we'll give it a shot. And what are we looking at? Calendar view, list view. Let's just do a search, see what it says. Hey, here it is. So it had a meeting here are the meetings for this year set. And it even has subcommittees, health, planning, et cetera, financial. So there's 3 meetings a month, and it has them scheduled. It's sharing the 2023 meetings. And if I get down to the bottom of it, lovely, even has the past ones. Okay, so let's go see if there's any January. You know what? I'm going to do that. I'm going to say I only care about this year. So I only care about 1/1/23 to January 16th of 24. Okay, so again, here when I go to the bottom, I should see this month and last month. So there was a meeting 17th, 4 days ago, of the subcommittees. The 23rd, that sounds like that's Monday. Monday at 2:00, the SEBC meets as a public meeting. And then when I click on that, I'm going to click on this one right here. Okay, you can see this here. Click on it, says, hey, look, this is a meeting for Monday, January 23rd. That's this Monday. How the heck do I watch this thing? Oh, look, I've got a link here. There's a Teams meeting. I can join by phone. Here's the meeting ID. Meeting materials are posted here after each meeting. So when they have presentations, PowerPoints, and things like that, you will find it here. Oh, gosh, let's look. I wouldn't mean this seriously. Look, it has an agenda. Look, it has a document. And it looks like that document has been changed several times, including on Thursday. Let's start with the agenda. And I'm going to open it up. And what it says is we're going to look at the minutes. We're going to get some updates from the subcommittees. Remember, they just met this past week. We're going to look at the fund, look at the financials. We're going to look at the GHIP strategic framework. I bet health insurance is in there someplace, but that's probably for current employees, their health care. Prudent RX, I'm guessing that's prescription drug issue, other business, public comment. And then there will be an executive session, and it's for things having to do with trade secrets and financial stuff that's privileged and confidential, and then they will adjourn. So that's the agenda. Again, all the meeting information is there. Now I'm going to go back. Try to go back. Here we go. And I'm going to say, what is that document they talk about? Well, let's see. Let's open that son of a gun up. Oh, here we go. Okay, so here are the minutes from the last meeting, and you can see who attended. Wow, that's a lot of people. And then it goes through each of the items that was discussed. And then I want to get, there we go with the GHIP, whatever the heck that is. And then public comments. Several state retirees addressed concerns over the employee preferences survey, etc. I'm seeing nothing else big in there. So that's in there. That's the minutes. They did some presentations to the health fund. Here's the GHIP stuff, the nice little disclaimer. It talks all about that. Anyway, everything this is what they currently plan to present on Monday's meeting. And it is all there by going to Google and Delaware Public Meeting Calendar and putting SEBC in. And once the newly formed Retiree Benefit Healthcare thing, which has its funny new name, Once that is put in there, then we will, that will be a subcommittee that shows up here also. Okay, I got to that one. I'm on the committee. Let's see. I'm saying the next newsletter. Yeah, indeed. I made. Let me get back to my face here because we love that. When I accepted the appointment to the committee, I said I've got two promises that I'm making. One is that I will strive to keep all of my colleagues in the House Democratic Caucus informed of where things stand, what's going on, and I'll be available for questions and try to get answers to any questions that they share with me. And I also want to make sure that the public is kept apprised of what's going on with the committee. So, among other things, that's why I'm here today on the Facebook Live. Indeed, I will, when there's stuff going on, I will try to get it into e-blasts and Facebook posts. When there's meetings, I'll get that stuff. I've also reached out to RISE, and I'm not a member of RISE. I think there's some great people with RISE, and they're working on important stuff. But I view myself as I need to be looking at everyone, and I don't want to hold myself into one perspective. But I'm committed to make sure that RISE it has full access to the public information. So I'm trying to get information. I've already sent the presentation that I've shown you today to RISE to make sure that they have public information in as timely a manner as I can. So I'm doing that now. Did I miss anything? Who all's on the committee? Okay, so that's a good question, Clint. Let me pull back up SB 29. So here we go. So this is the new committee, newly formed one. So who's on it? Lieutenant Governor will be the chair. The insurance commissioner, so both of those are elected. The director of OMB, that's Office of Management and Budget. The Secretary of Finance, Secretary of Human Resources. 4 legislators, one appointed by heads of each of the 4 caucuses, so it's balanced. And I'm expecting to be appointed to this the same as I am for the RHVC. Then the governor shall appoint 1 retired state employee from each county and 1 representative of a union of state employees. Speaker shall do 1, and the so 1 from each county, and President Pro Tem will do the 1 as far as who does the appointments. Lieutenant Governor shall serve as the chair, and members of the majority caucus from the House and the Senate shall serve as the co-vice chairs of the subcommittee. The Department of Justice will provide legal support, and the Department of Human Resources will provide administrative support, and OPM will have support as requested. So those are the members. I think the numbers are somewhere in the 13, 15 range. Okay. I think I addressed the questions that came in. Please, I put my email in there. Please do not hesitate to reach out if you have any questions in the coming days, weeks, and months on this topic. It is possible that this subcommittee is going to be meeting a lot. I've heard one estimate of every 2 weeks. These meetings are open to the public. And I know that there's a lot of frustration over most retirees not knowing what was going on during 2021 and early 2022 in this matter. And some individuals within the government would say, oh, public meetings, there was posted, I showed you how easy it was to find it, but it doesn't mean that you know about that. What I think we know is, I'm not going to say we're not going to, it wasn't a mistake. I'm not going to characterize it as a mistake, but I don't think this is going to be under the radar anymore. I think there's no question groups like RISE are committed to make sure that people know what's going on. So I know their eyes are on it. I know that I'm sharing with them to make sure their eyes are on it. And there's others who are very dedicated to looking at this. I know there's an active group within the University of Delaware Faculty Senate and retirees, and I hear from them periodically. So I don't think we have any risk of important decisions like this going under the radar over the next few years. So that's a silver lining of the saga that we've gone through over the past year or two. So keep your eyes open. I don't know if we'll have an email list of those who would like to be notified when there's meetings. That might be something that we talk about in the first meeting of the subcommittee. So anyway, that is it for now. I hope that this was a good use of your time. I will try to be doing this periodically when there are things to share, most often on the weekends when I sort of catch my breath. And we'll see how that goes. So, as I typically end things, please stay safe and stay healthy. We have one more week of legislative session this week, and then we have the break for the budget committee to do its work. But I would expect that this subcommittee, I would expect that SB 29 will pass this upcoming week, and I would expect that the subcommittee will be formed and meeting by the end of February. And there you go. So Sherry points out you can sign up for the public meeting updates, and they can get informed. So, and I think that's a good. I think that's a good thing to do our best to make sure that we have that's working. So again, stay safe, stay healthy. Thank you for taking the time, and I will be talking to you later. Take care.